Welcome to the Resident and Family Support Council. Today we're going to be talking about how to advocate for yourself or your loved one without fear of retaliation. To get us started in this conversation, let me introduce Stephen Maxwell, who is the Regional Ombudsman for Adams, Brown, Calhoun, Hancock, Pike, and Schuyler County. Would you like to get us started on this conversation, Stephen?
Yeah, sure. Let me just share my PowerPoint here really quick. Hopefully this works right.
It looks like you started.
All right. Is that sharing the presentation?
Yes, your presentation.
Okay, perfect. I'm going to talk about advocating for yourself. Like Lee mentioned, I'm the regional ombudsman for West Central Illinois. And now advocating for yourself it's a kind of a broad topic. So I'm going to give an overview of your options. Some strategies may not apply to all situations. So what might work for cold coffee might not work for abuse. Also, as an ombudsman, I primarily work with nursing home and assisted living residents. So that's where I'm coming from. Also, I'm going to use the word resident a lot, but unless I indicate otherwise, that can also mean the power of attorney as well. So why should you self-advocate? Well, you can explain your needs better than anyone else. You know your situation better than anyone else. And in many cases, speaking up, you can make your life better. Now, there's a lot of reasons why people don't want to speak up for themselves. Some people, they don't want to be a bother. Well, you don't have to worry about being a bother because the staff are there to work for the resident. They're being paid to take care of all your wants and needs. So don't worry about being a bother to them. A lot of people will worry and say that it's not worth their time to go after something. And maybe that's true. But it's a good idea to at least let someone know, let the ombudsman know, because maybe it's not worth your time, but maybe there's 15 other people who are saying the same problem. And we're not finding it because nobody's speaking up, and we need the right questions to ask. So letting us know can be helpful. I hear a lot of times that people will say it won't do any good. Well, you don't know that it won't do any good until you try. And even if change isn't made for you, by advocating, you're creating documentation. It's this data that you're creating can, in the long term, lead to changes in your home or even systemic changes. And then finally, a lot of people are afraid of retaliation. Most of the time, the issues that are brought to me aren't going to lead to retaliation. But if that's a concern of yours, talk to the ombudsman. Maybe we can handle things anonymously or systemically, or maybe it won't lead to retaliation. And finally, retaliation is illegal. We're going to talk more about retaliation later on. So let's jump on in to the in-house routes of self-advocacy. These are ways that you can advocate for yourself inside of your facility without involving outside agencies. The simplest way is to just talk with staff, and it's often the fastest route to a solution. It's best for in-the-moment issues. So maybe your water's been placed too far away, or you need your feet covered a little bit better. It's in the moment. Now, it's important that you speak directly with the staff involved. If you've got an issue with your laundry, don't talk to a CNA about it, because that message probably isn't going to get passed on. If you've got an issue with third shift, don't talk to a first shift CNA about it, because that message is not going to make it through second shift to third shift. In those cases, it's best to talk with a supervisor. Now, when you talk to someone, make sure that you document who you spoke to, what you spoke about, when you spoke to them, and what their response was. This could be maybe on a calendar or maybe a little journal that you keep on who you're talking to. Talking with supervisors. Now, the supervisors include people like the unit coordinator, the director of nursing, social services, the administrator. You should have a pretty quick response time. If you ask to speak with a supervisor, someone should be following up with you in a day or two. That's in my experience in my area. People get fairly quick response. You want to use them to address issues that are maybe ongoing. So like if the water is chronically placed out of reach, if you have unresponsive staff, if you have staff who've maybe been rude to you, if you've experienced abuse or neglect, or like I mentioned, issues involving a different shift. And like when you're talking with staff, you want to document who you talked to, what you talked about, when you spoke to them, and what their response was. This documentation will help you if they're not responding quickly or responding appropriately. Another option that you have is you can file a grievance. All nursing homes are required to have a grievance procedure, and there should be a link to the federal regulations in the chat. Many assisted living and supportive living facilities also have a sort of grievance procedure that's pretty similar. It's good business to have a way to provide anonymous grievances. So the response time should be fairly quick. They can vary, but usually you're going to get a response in about a week. Facilities have to allow those who are filing a grievance to remain anonymous. Now, if it's anonymous, you may not get a response directly. It might be posted somewhere. So if you want to go the anonymous route, find out where they're posting anonymous concerns. The grievance procedure is generally you fill out a form and you put it in a box, and then the grievance officer takes that, types it up, and sends it to the appropriate director, and the director then responds to the grievance officer, and then the grievance officer takes the grievance either to the person, or if it was anonymous, to wherever they put the anonymous complaints or the anonymous grievances. So in this process, there's a written record of the issue, and there's a written response. And then during the annual survey, grievances are reviewed by public health surveyors. And since this is a formal process, the facility has to keep records of grievances that have been filed for a minimum of 3 years. There's also a grievance fact sheet that's in the chat box if you have more questions on that. The resident council is a monthly meeting for nursing home residents. Other sorts of facilities, assisted, supportive, will often have a resident council as well. If the residents So guests are allowed at the consent of the residents. So if you as a family member want to attend a resident council meeting, I recommend showing up a little bit early to the scheduled time. It's posted on the activities calendar. Show up a little early and talk to the resident council president. They can, they'll take a vote at the beginning of the meeting to let you in or not, and they can revoke that privilege at any time. The resident council is a great place for residents to come together and discuss and confirm concerns. So, maybe you feel as like a resident, you feel like you're the only person who's getting late or delayed call light responses. You can go to the resident council and discuss that and see what other people are experiencing. So that way you can know that you're not alone. The resident council also creates written minutes. And if the, so it's creating a record that this was discussed. And the minutes are read at the next meeting, so you can confirm if your concern was included in that or not. And then as with the grievance procedures, a sample of the minutes is looked over during the annual survey. Last but not least, if you need long-term changes to your care needs or your personal preferences, you can have it addressed in your care plan. Your care plan is almost like a contract with the facility. It lays out your medical and your personal preferences and what the facility is responsible for doing in addressing them. The care plan meeting has to be held on admission and then every 90 days thereafter. It can be held on request or after a change in your condition. Sometimes small changes can be made in between meetings, but only with your consent. Now, the care plan meeting is really important to attend. You wouldn't want changes in your care plan to be made without your consent. And so attending it will help you stay informed and help you give your input. In order to be able to attend it, the care plan meeting has to be accessible to the resident and the power of attorney. So if you're a resident who's bedbound, the facility should be bringing the care plan meeting to you. And if you as a resident love Drew Carey, the facility should have a good reason for setting that care plan meeting at 10:30. The Price is Right is on from 10 to 11. So they should have a good reason. It has to be accessible to you. Finally, make sure that you get a copy of your care plan. Again, this is like a contract, and they can get in some trouble if they don't live up to that contract. So if your care plan isn't being followed, talk with a supervisor, talk with your ombudsman, or file a complaint. And we'll talk about some of those options later. It's really important when you're working with staff to ask questions, especially when you're dealing with complex issues. If you don't understand a certain term, ask them what it means. Refer back to the care plan. Ask them how an action fits into your care plan. So, if your loved one is chronically dehydrated and the care plan says that they're supposed to give her water, ask them how often they're bringing the water. Ask them how often they're encouraging her to drink. As a resident and as the healthcare power of attorney, you have the right to ask for records. Now, they are required to provide, nursing homes are required to provide them within 2 business days, but they can charge a reasonable fee for providing those records. Look over the records, ask questions if you have them, and I really encourage you to ask questions about any vague entries that might be in there. Now, a lot of times entries are written quickly, but if you've got an incident and the entries around them are vague, they might be skipping over something. We had an incident a few years ago where a resident walked outside. She had dementia. She walked outside and a staff came up and grabbed her from behind in an attempt to bring her back inside. And the staff was shocked when the resident attacked her. Well, looking at the records said that the staff attempted to redirect the resident and the resident attacked the staff. So ask questions. Ask them, what do you mean by redirect? Now we're going to look at outside routes for self-advocacy. So maybe you've worked on trying to address issues inside and it's not working, or maybe you're not feeling comfortable with going to them. So the Ombudsman program, ombudsmen are resident-directed, person-centered advocates. Now, I know we have a lot of families on here right now, and I'm sure there's a few facility staff as well. We work for the resident. We work for the resident first. We'll take complaints from anybody, but we don't take direction from the facility or family members. If the resident can't give us direction, then we can look to the power of attorney. But primarily, we work for the resident. And we won't work on an issue unless the resident gives us permission to work on it. And so if you're needing advice on how to resolve an issue yourself, or advice on the direction that you need to go, you can talk with the ombudsman and we will give you confidential feedback on it. We can also work to facilitate communication. I've seen situations where residents and staff are communicating, but they're not even in the same book, let alone the same page. And since I'm kind of watching from the outside, sometimes I can see that and get everybody on the same book, in the same chapter. We can also discreetly investigate concerns. Maybe you feel like you're the only resident who has a problem with this one nurse. You tell us about it, and we can go room to room and ask residents if they've had any issues with the staff on the afternoon staff. I've had cases like that where one person said, I've got some concerns with this staff, but I feel like it's only me. Well, it turns out 5 other residents had the same concern. Letting us know helps us to investigate and see if we can find other problems. And we can take those issues anonymously and systemically to try and resolve them. And finally, the ombudsman create a documentation outside of the facility. Now, we can't share specifics without a resident's permission, but we can share trends, we can share data points, and these can help create systemic change over time. Licensing and regulatory agency is another route you can go. Now, for most of you, that's going to be the Illinois Department of Public Health. In the chat box, you can see a list of facility types and where you can file a complaint. Now, these are best for your chronic or most serious concerns. So if you got cold coffee in the morning, might not be appropriate for this, But if your food is chronically coming in at the wrong temperature, or your loved one says that they were hit by a staff, those are things that you can file a complaint on. And if there are any staff on the call here today, you're mandated reporters, and the bar is very low. So if you have to ask if you should call something in or not, chances are you should probably call it in. The Illinois Department of Public Health has different methods through which you can file a complaint. You can do phone, fax, email, snail mail. There should be a link to the form in the chat. I find that an emailed complaint, I wrote written, but I meant emailed complaint, is the best, because you've got a copy of the record that you're sending off to them. You know it got through, and you don't have to deal with a call center. Most of your complaints to public health are going to be investigated within 30 days, depending on the severity. Most severe cases of abuse, the response time is going to be how far away is the surveyor from the facility. But most of the time you're going to hear back within 30 days. The complaint process can be anonymous, but if you don't share your name with public health, you're not going to get the results from that complaint. Valid complaints can lead to change. I'm not going to explain what it takes for a complaint to be valid, at least not on this slide. But if a complaint is valid, it often requires a plan of corrections. In other words, the facility has to explain what they're going to do to correct the problem. More serious complaints can result in a fine. If the complaint is not valid, it still creates a record of that complaint outside of the facility. And over time, it can show patterns in specific nursing homes or patterns in the industry that need to be addressed. Now, the common theme that has been running through my speech today has been documentation. It is incredibly important to document, because in order for a complaint to be valid, the surveyor has to have enough facts to show that the facility wasn't fully in compliance with state and federal regulations. So the more you document, the better you'll be able to give more information. And the more information you can give, the easier it's going to be to follow up. You know, I've had residents bring me concerns that, you know, there was a blonde nurse who was rude to them a couple weeks ago. That's really hard to follow up on, because when I go out into the hallway, you know, there's two blonde CNAs and one blonde nurse, and that's just on this shift. So if you can be specific and get names if you can, descriptions if you can't, that'll just make it a lot easier on the surveyor to come in and keep records. You want to be able to show the who, what, where, when, and how, and what the impact was on you. If you discussed it in the resident council, let the surveyor know that. Let them know when. That way they can go back and look at resident council minutes. If you talk to the ombudsman, let them know that you spoke with the ombudsman. So, you know, there's just some basic tips. Make sure you're keeping your documentation. Now, when you're filing a complaint, it's good to include the resident's name, the facility name and address. And I'll tell you, I work with Area 3 up in the Rock Island area. And it is really important to be very clear what your facility name is and what the address is, because some places have similar names or they'll change names. So be very clear on that point. If you can include the name and contact information of any witnesses, the names of employees involved, important dates, and be clear on your specific allegations. Was there abuse? Was there a medication error? Did the facility refuse to allow a compassionate care visit? Be clear on what the problem is. When did the incident occur? When did the incident occur? How was the resident harmed? And then how was the complaint addressed by the facility, if it was addressed at all? And so that is how you can go about looking at advocating for yourself within the system. And now I'm going to turn it over to Carrie Leljadal, who will talk about some other options you might have. Carrie, you're muted.
Sorry. So I'm Carrie with Illinois Caregivers for Compromise. We were created with a common goal of advocating for our loved ones that are all in a variety of different residential care facilities around the state, who have all been suffering, due to the isolation from COVID and the restrictions. By working together this past year, we've really created a really good support system for each other and a voice to be heard very publicly. Everything from government agencies to the media, we've been outreach in every direction we can. We have created documents and videos to try to help families to understand what compassionate and essential care are and how to get it. Next slide, please. As I'm trying to figure this out too. Our Facebook page is usually the best place to start to find information. We have everything from our e-blasts on there to information from the IDPH and CMS guidance. All of that is in the file section up on the top of our page. We also have a YouTube channel that you'll find copies of our weekly Zoom meetings, information on how to request compassionate or essential care. And if IDPH has made really important statements that will help us, we cut their videos apart and put them on YouTube so people can find them to show your facilities when you need them. Right now we have weekly Zoom meetings every Thursday. The first, third, and fifth Thursday of the month, they're at 9 a.m. And on the second and fourth Thursday of the month, they're at 7 p.m. The meetings provide both support and information with the latest guidance, changes that are being made, and what everyone's hearing. So we are all trying to stay on the same page to help each other. We do record our Zoom meetings, and Fran posts them on Facebook, or not on Facebook, sorry, on YouTube as soon as she can. They are open to anybody who wants to join us. The nice thing is if you go on our Facebook page, our Zoom link does not change. So once you save that link, you have it for every meeting. The e-blast we're trying to send right now every week or two, using it as reminders of upcoming meetings, any guidance that's changed, or anything else we think people need to be aware of. When we ask for your information, we'll send you an e-blast. We will not share it with anybody because we just need it so we can email you. And then the two most important things that when it comes to advocating, sorry, Stephen, I keep forgetting to tell you to change the page. Advocating and working with your facilities is make sure when you're talking to them, first of all, I tell everybody, do it by email, do it by text. This way you have documentation when you need it. Stephen said it, I say it all day long to people, document, 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 because that's in the end how you're going to get what you need for your loved one. You know, if you're having concerns and the facility's not working with you, go to your ombudsman. That's always the best place to start. And if you get that you've run out of every other option and you get to where you have to file a complaint, if you know your complaint was truly valid and somebody should have done something and you get a no violations found, don't give up. Please file again. First of all, the first good half of the year, last year, the inspectors were not going into the facilities. And even now, they're supposed to be going in, but I'm not sure if they are. So the only way we're going to fix some of what is going on is to ask the ombudsman for help and go to the state. It's really important. That's everything I have. I think it's to you next, Kelly.
Yep, Kelly, you're up.
Okay, good afternoon, everyone. Happy to be here this afternoon. And thank you, Carrie, and thank you, Stephen. What I'm going to be covering this afternoon, as you all can see on the slide, is retaliation. And I may end up saying some of the things that Stephen and Carrie have said as well. So we're going to first start by going through a video that was developed by the Ombudsman program in Texas. And then after this video, I'll go take a little deeper dive. Is there volume?
Sorry. All right, here we go. Is that better?
Nope. Can you click on the volume to make it go up? Right there.
Yeah, I'm not sure what's going on with the
Even
volume.
do you have volume on your screen? Are you getting volume?
Yeah, I have sound.
You do. Okay.
Yeah.
If you mute yourself while you're trying to play it, it will stop. We figured
Right.
that out with Lee.
Yes.
Yeah, I unmuted myself.
Okay.
So not sure, but it is saying it's typing everything that's said. So I think we can just roll with it.
Okay. Do you?
It's not ideal.
I was thinking perhaps we can go back and start it from the beginning since we were trying to. I'm sorry, everyone, that you all can't hear it, but the sound goes along with what's on the screen. So if we could just start from the beginning.
There we go.
Stephen, I hate to take a pause in this, but if we could pause it again, because we do have people that are on the phone, so they can't hear this. So I think what I can do is read the slides as they're going through it. Could we do that? So as the video is playing, I can just go ahead and read it.
Yeah, okay.
Okay, sorry. I want to make sure people that are on the phone can hear it. So I hate to do this that we're starting again, but.
Thanks, Lee. I didn't realize that there were people on the phone. So
yes.
That makes sense. Thank you.
Okay. Okay.
All right, you ready?
Yep, I'm ready.
Okay.
Your life, your care, your choice. This is your home and you do not have to accept things that are not okay. I'm worried that if I say anything to staff, I'll make them mad at me and they won't want to help me. That's actually a common concern. Fortunately, there are laws prohibiting retaliation, neglect, and abuse. If you have a reason to suspect that you are being retaliated against for speaking up, call your ombudsman. Your residents' rights guarantee your quality of life, but you have to speak up. How do I start? Glad you asked. Attend a resident council meeting. Talk to social services staff. Use the suggestion box. Fill out a satisfaction survey or call the facility satisfaction hotline. Ask for a care conference or call your long-term care ombudsman. If you don't speak up, things will stay the same. Speak up. Know your rights. Happy Residents' Rights Month. So, thank you.
Thanks, Lee. And again, we apologize that we couldn't get sound on this video. So a lot of what you saw in the video was covered. It sounds familiar based on what Stephen had said earlier. And I just want to stress the importance of speaking up. And as the slide had indicated, if you don't speak up, things will not get better. So as it relates to retaliation, retaliation is one of the most common reasons expressed by residents for not speaking up and seeking a resolution to their concerns. Retaliation may be real or perceived, but in either situation, it is frightening to residents. I think it's important for us to define for everyone what retaliation is. And retaliation is defined as a negative action or something, or sometimes an inaction committed by a staff in response to a complaint made to the facility or made to another entity like the Ombudsman Program or the Illinois Department of Public Health. One suggestion is to have an honest conversation with your ombudsman about your concerns with regards to retaliation. Ombudsman might have suggestions on ways to handle the complaint that reduce the likelihood of retaliations. These suggestions may include issues that the resident to bring to the resident council rather than directly to the facility staff, or working with the ombudsman to determine if others in the facility share the same complaint. You know, sometimes it is strength in numbers. Or even calling out concerns about retaliation directly to the administrator with a subtle reminder that retaliation is illegal. And I believe that Stephen mentioned that earlier. And then with permission, the ombudsman might say something to the administrator like, Mrs. Jones has expressed concern about retaliation. I informed her that retaliation is illegal. It won't happen in your facility, right? Those are some ways in which you can try to address it. So on the next slide, it contains an excerpt of the State Operations Manual, which is a document that's produced by the Centers for Medicare and Medicaid, which directs the state regulatory agencies on how to conduct surveys and enforces federal regulations in certified nursing homes. This slide is quite lengthy, but the bottom line is this. Feds have given guidance that all staff expected to be in control of their own behavior, are to behave professionally, should appropriately understand how to work with nursing home population. Retaliation by staff is abuse. regardless of whether harm was intended, and must be cited. So on our next slide, and I mentioned previously that retaliation can either be subtle or it can be obvious. And on the left side of the slide, you can see some examples of subtle retaliation. Call lights not being answered, or staff delays responding to call lights, staff completely ignoring residents' questions for help, staff withholding pain medication, or staff are late when distributing medication. And then the more obvious instances would be retaliation, including rough care, abusive treatment, evicting a resident, evicting a resident or threatening discharge of a resident, and also withholding food and water. So you may be asking, what do you do if retaliation occurs? And the first thing I would say, which was on the slide, on the video that you all didn't hear, and Stephen has said it as well, speak up. If you don't tell someone what's going on, how can people help you? Make sure that you're documenting the facts. I think that that has been repeated throughout this entire time that we've been speaking. Document, document, document. It can, you can have a small journal with noted times and those persons that were involved in your conversation or an incident, or maybe instead of keeping a journal, as Carrie indicated, do text messaging or call a loved one and ask them to write the information down for you. Contact your ombudsman. Let them know what is happening and see if there are suggestions for you to consider. Consider talking to the administrator. This may not be the solution you want to attempt if the administrator is the one that's doing that retaliation. But if it's a different staff member, reporting the retaliation to the administrator might be a good option. Consider filing a complaint with the regulatory agency, as I mentioned earlier, the Illinois Department of Public Health. For most facility types, this is going to be the Illinois Department of Public Health, and you can refer to the facility types and where to file a complaint document to double check where to file your complaint. And I believe that information was given in the chat. And remember, retaliation is illegal, but unfortunately, at times it does occur. Hopefully you'll have a better understanding of the various avenues available to you when deciding what to do with the problem that you're facing. And thank you. Stephen or Carrie, I don't know if I'm bouncing it back to you all or if we're just taking questions.
Yeah, I can go ahead and we'll put it to Chuck and to Teresa. I know we've been getting a lot of conversation happening in the chat box. If you want to go ahead, Chuck or Teresa, are there some questions? There's a lot of answers that have also been given in the chat as well, but I do want to be conscious of the people who are listening on their phone and can't read the dialogue that's going on. So we also have a lot of links in that chat box as well. And that is easy to get to if they want to either save that file, or that's also saved when we save this recorded version of the meeting as well. Does the nursing home info presented relate to memory care facilities as far as getting copies of the care plan for the power of attorney?
So yes, if you're the power of attorney and you have someone in memory care, you should be able to get the care plan and other information.
Note too that assisted living may not be referring to it as a care plan. They may be referring it to it as a service plan.
Yeah.
So if you present them with I want to see a care plan, they say we don't do that. They may actually be referring to it as a service plan. So that might be important for people to understand as well.
And in the ICFDDs, it would be the ISPs.
Individual service plan.
Yes.
Right. Yes. Okay.
Okay. Are we ready for the next question?
Yep.
Okay. Okay, who or what is the agency that one can file a complaint with regarding a behavioral health long-term care facility?
So
Oh, go ahead, Stephen.
I mean, if it's like a nursing home, then it's going to be the Department of Public Health.
Right. Okay. So all of these suggestions require a resident who is of sound mind. POAs cannot go into facilities for the last year to observe. That's more of a statement than a question, but I think they were wanting to lead into possibly getting some clearance or clarification on that.
Yeah,
go ahead, Stephen.
Yeah, my primary focus is on the resident, but you know, so it is kind of limited, you know, the advice that I gave in that regards. But as power of attorney, you can still request you know, records and, you know, look over the care plan. Even though you're not allowed in the building, you should be able to attend the care plan meeting on the phone.
Right. Yes. We have also, there's 3 different places in the chat where we have shared information about the essential caregiver guidance from the Illinois Department of Public Health.
Right. And by this point, anybody who is not getting in, whether it is even a minimum, an outside visit, if there's a facilities that are not allowing for any visitation, they need to be reported by this point. It's been going on close to 6 weeks.
Okay. I'm scrolling through some links, so give me just a moment. There's some comments about how some facilities have not resumed resident council meetings in their facilities. So what should somebody do if they're wanting to get the facility to get back on track with those?
Well, I can answer. This is Lee. I do know that many, they might not be doing a formal resident council meeting because they are limited to not being able to bring everybody into the rooms together to do resident council as it traditionally looked before the pandemic. So there were many long-term care communities were going room to room and asking people questions about if they had any comments about anything that they needed, any assistance with, did they have any concerns that they wanted to bring up? So people were going room to room on that one. I also do know of some communities that were doing it via Zoom, some similar to how we're doing it today. They were using iPads and closed circuit TVs and things like that in order to get resident council meetings happening. But if none of those are happening, reach out to the administrator, reach out. Many times it's overseen by the activity director, reach out to them and ask them point blank, what's going on with resident council meetings? I understand that these need to be happening. And there was never supposed to officially be a pause on any of that. They were supposed to continue to be doing these all along, but it was kind of being looked the other way because as people were trying to navigate what that was going to look like. So they should be going back to doing them. And if they're not, maybe your encouragement will allow that to happen because it is a right.
Yeah, and going off of that, you know, it is a right. So if they're not restarting a formal resident council, call your ombudsman and ask for the ombudsman to help, because that's right up our alley for what we do. Another thing, you can ask who your resident council president is and ask for their contact information. Give them a call and say, hey, this is an issue that's happening to me. Can you make sure that it's addressed to staff? Because that's what the resident council president is for, is to help take concerns to the staff.
Very good point. When is the next Caregivers for Compromise meeting?
Thursday morning at 9 o'clock. And the link is in the chat box.
It is in the chat box. Yes, my apologies.
No, that's fine.
How are retaliations against a family member handled for advocating for a family member?
I would say, I mean, that's kind of a
Mm.
open-ended question. There's a lot of ways that could go, but if you feel like the residents' rights have been violated in some way in that retaliation, call the ombudsman, call and file a complaint with public health.
Yes, Stephen, I was going to say the same thing. I feel that we probably would need a little bit more information on that, what that retaliation was looking like. And I would really encourage to have a conversation with the ombudsman who could talk it through and see how that's affecting, because we are here to advocate for the residents. We're not family advocates, but many times that can look like very blurred. So I would really encourage reaching out to your local ombudsman, and I believe that information was all shared. The links were shared at the beginning of the presentation. Or if you just want to type your county in, we can tell you directly who to reach out to, and you can get connected to them right away.
And honestly, from what I hear from people, Teresa, I think a lot of it's passive aggressive. Ooh, if we ignore you long enough, you might go away and we don't have to do what you're asking us to do for your family member. So some of it's even just that. It's just the passive aggressive, finding ways to not acknowledge the families.
Mhm. Great information. What happens if the facility doesn't notify in advance for the care plan meeting?
Well, if they're not notifying the resident and they're not notifying the power of attorney, they didn't have a care plan meeting and they need to do it again.
It's part of the regulatory requirement. So it needs to be happening. If you have not gotten, and they happen in skilled care, they happen every 3 months. And in assisted living, they're only required to do it annually. So if a significant change happens in both locations, I know that for assisted living and for skilled, that's who I can speak to. So if you have not been hearing from, if your loved one is in skilled care or you yourself are in skilled care, and you have not been informed of a care plan meeting happening within the last 3 months, you need to reach out to somebody and say, I need a care plan meeting. Why is this not happening? It might be happening behind closed doors, and they have not fully understood that they still have to be happening, and via phone is a great way to do this. We don't necessarily have to be meeting in person. Again, via Zoom is another opportunity to do it so that you can get your eyes on people. That can be very important as well.
Great information.
And I do want to just make a comment. If the facility says, well, we don't have Zoom, so we don't do Zoom, anybody can sign up for a free Zoom account. And the way that works is it can't go longer than an hour. So you can, they say they don't, say, well, then I'll go ahead and get one and I'll send you the link so that we can meet face to face, because I want my mom involved face to face. I want to be involved face to face. I want to see the team face to face. So I can go ahead and set up a Zoom account myself and send the invitation to everybody so we can all be present together to have this conversation about my mother.
Okay, you have one more question, I think, in the box, and that's probably what we have time for.
Yep. I have requested active restorative care for my relative who is quadriplegic. However, this is not happening consistently or not at all. I requested restorative care notes. I did not receive anything. How should the situation be best handled?
My first response would be, we need to know if you're the power of attorney for healthcare, because it can't be provided if you're not. So that would be the first thing. So you are power of attorney for healthcare, great. So if you request it, personally, I would probably be on the phone every day until I got it, because I wouldn't even want to just file a complaint about something like that. I would want to get on it right away because I want to see what's going on. I'd call the administrator. I'd call the director of nursing. I would call the restorative nurse, because typically there's a nurse that oversees that program. And I would keep this happening until I could get my hands on that. You could say I'm coming to the facility to pick it up. So if you could please just copy those, and you may have to be charged a nominal fee for those copies. Just know that that is part of that's part of the procedure. So they might charge you 10 cents a copy or whatever. But that's what I would do. I don't know if anyone else has any other ideas on what they would do for that.
Yeah, I think what I would do is I would keep track of the times that I've called to make the request, or I would email the request. And I like what you said, Lee. I'll be there, and I'll be there tomorrow to pick them up. And if you've got the email request, I mean, that's documentation right there.
Mm-hmm.
That's evidence that if you have a situation, if it continues and you need to, file a complaint with public health, you can say, here, I emailed and asked them, and here's the times I called them.
And it feels to me that sometimes when we do things where we set a date and a time, that can be more effective for people. I expect to hear back from you by yada, yada, yada. I will be there tomorrow at this time to pick this up. I think that sometimes that can be a little bit more directive to people so that they understand that this is of an urgency for you because this is somebody that you love. And contact your long-term care ombudsman, as Teresa's always reminding us. I think that that's important as well. It looks like we've hit the end of our time, and to be respectful for everybody, it does look like we did get through all the questions, but if you have any other questions, we will be keeping this open for at least 10 minutes after. If I continue to see chatting happening, I will not shut it down until everybody gets their questions asked. And also, there are a lot of links that were shared this time. So I want to make the recommendation that you go ahead and you click on all those links so you can have an opportunity to peruse those at your own leisure. All you have to do is go to that link, and many of them are listed in the beginning. If you go to the chat box and you go to the very beginning of the presentation, you will see all those links up listed there. So if you click on each of those, it'll bring you to the page for that direct link. And then if you open them each up, then you can go back later on, even after the presentation's over, to take a look at that stuff. And there are some great documents in there to really assist you in making sure that you're advocating well for yourself and or those that you care about.
Can we email those to everybody that signed up for today's meeting for constant contact?
Yeah, you know what? I'll put them all on one document and I'll email them out to everybody.
That would be great.
Okay. And then I just also want to remind everybody that next meeting, we really want to hear your stories. We're going to be opening up the mic, so we'll be doing some hand raising, and we'll kind of go through what that looks like. And we're having people directly sharing themselves and asking questions themselves. And also, I want you to think long and hard about this. What other topics would you like to see? I feel the topics that we have been discussing so far have been very, very helpful for people, particularly during this pandemic. But also, if there are any topics that might not even be pandemic related. I know that there was some conversation that I had privately with somebody regarding about the power of attorney. So maybe, that might be a topic area that people want more information on. What are my rights as a power of attorney for healthcare? So think about that and come to the next meeting on May 11th at 3 o'clock. You do need to register for each meeting separately. Unfortunately, at this time, that's the way it's working due to our limits in the number of people that we can have, but we will open that up if we continue to grow as we've been growing in numbers. So I want to thank everybody for attending today. And thank you, Stephen. Thank you, Carrie. Thank you, Kelly, for the really useful information that you guys shared today. Thanks a lot. Everyone have a really great day. And we look forward to our next meeting on May 11th. Bye-bye.